Hello, welcome to the journey in pursuit of health and happiness. We know that health and happiness is now an industry, in fact, a multi-million industry. So, when it becomes an industry, there are a few unpleasant things that creep into health. I had a patient who is just 38 years old. She's been detected a diabetic a couple of years back, and while she was regularly on medications, few people told her that these medications may do a lot of harm to you eventually. So go on to some mode of treatment where your diabetes will be totally cured and you would be off all the drugs. So she resorted to a treatment modality called acupuncture, acupressure, whatever. Anyway, I was totally surprised and I was totally worried when I saw her reports after 6 months. She had lost nearly 5 kilos. Her sugars were to the tune of 300s and 400s, and HbA1c was to the tune of 15. So absolutely the sugars were haywire. In a few months time, the total control was gone, and the insulinopenia or the high blood sugars were taking its toll in terms of the lot of weight loss that she had. So when I talked to her, it was all about bursting the myth, dispelling the myth that the anti-diabetic drugs cause a lot of damage. So today I would attempt to burst a few myths or dispel a few unscientific ideas which always creep in when one is treating a chronic illness, an illness which requires treatment year after year, monitoring day after day. It's very cumbersome, it's very boring. The whole life starts to revolve around the disease. So in such situations, it is but natural that magical treatments come into play, and people find it more easy to accept these magical remedies which claim that you would be cured of the disease, whereas modern medicine doesn't say you would be cured of the disease. It says that we can control the disease and we can keep you free from complications. I would like to tell you a few things regarding the pathogenesis or how diabetes is caused. Before bursting the myth of drugs causing a lot of liver and kidney damage, we know that diabetes is caused by the type 2 diabetes. I am talking about generally about type 2 diabetes because that is the most prevalent form of diabetes in the society, and it is caused by relative shortage of insulin. We know that sometimes, but the insulin is not only there, but it's there in abundance. It's known as hyperinsulinism. There's another factor which is known as insulin resistance, that is caused by a lot of adiposity, especially the visceral adiposity or the fat that accumulates around the vital organs, especially in the abdomen and the liver. So this causes insulin resistance, and even if adequate insulin is produced from the beta cells of the pancreas, it is not able to do its work properly or metabolize glucose properly because of the insulin resistance. So insulin resistance is another factor. Apart from that, there are other players like we have a hormone called incretin. Incretin is a hormone that is formed in that is secreted in the small intestine. There is a gut-brain axis. Then there is vitamin D. There are a lot of other players apart from low insulin levels and insulin resistance. So when one treats diabetes successfully, all these factors have to be considered. It is not as simple as give any medication to anybody. We have to take a few things into consideration while we prescribe drugs. We have to take the age of the patient, age of the disease, what all comorbidities apart from diabetes the patient has, and the lifestyle and the socio-cultural background of the patients. So a treatment decision is made taking into consideration all these factors. So, and none of the drugs which we use for diabetes till date, invented till date, do not cause a direct kidney or liver damage. That's an absolute myth. Whatever damage to the kidneys happens, that is because of the disease. On an earlier occasion, we spoke about the metabolic memory or the legacy effect, which says that an early intensive diabetic control is essential in preventing complications. So, that applies for kidney disease as well. But in clinical practice, we see that there is a lot of inertia on the part of the doctor and on the part of the patient before we start on a drug treatment. So, usually our patients start drug treatment very late. So, they bring their sugars on target very late. As a result, there is already an onset of the diabetic complications like neuropathy, nephropathy, that is kidney disease, and retinopathy, that is the serious eye disease. So, lack of intensive and early treatment is what results in complications. It is not the drugs. On certain occasions, we need to modify some drugs or withdraw some drugs, but that is for different reasons. Otherwise, by and large, the anti-diabetics that we use and antihypertensives, that is the BP medications we use, do not cause liver or kidney damage. So, that's an absolute myth. So, next time someone asks you to stop your drugs and go on to indigenous treatment modalities which do not have any evidence whatsoever, please think twice, thrice, 4 times, because it's your body, it's your kidney, it's your nerves, and it's your retina that is going to be in trouble. So, let us move on to another myth that says that once you take insulin, once insulin, always insulin. You will never be able to withdraw insulin in your lifetime. So, people are very reluctant to use insulin, and we see that insulin initiation happens much later than it should happen. So, that results in a lot of beta cell exhaustion, lot of diabetic complications, and lot of cachectic effects or catabolic effects that happen. People lose their muscle bulk, they lose their weight. So, lot of effects that are a result of lack of insulin. So, where are the situations one should go on to insulin? Initial, on the detection of diabetes, if there is a confusion regarding the type of diabetes in young individuals, if on detection the sugars are very high, well, one should definitely start on insulin. Later on, one can, depending on the type of diabetes and the control that one achieves, one can move on to drugs. So, there is no truth in saying that once insulin, always insulin. In certain situations of stress and strain, when there is an emotional strain, when there is a surgery, when there is another illness or hospitalization for another illness, one needs to take insulin. So, don't fear to take insulin. Once you are out of the hospital, once you are done with that particular illness, you will be able to go on to your usual anti-diabetic tablets. So, don't worry or don't resist taking insulin for that reason. But there are certain situations where you need to be on insulin. One is type 1 diabetes, absolutely, there is no question about it. One needs to be on insulin lifelong. Pregnancy induced diabetes, again it's insulin. Then a situation where the oral anti-diabetic agents fail, that is beyond 7 to 8 years of diabetes detection. The tablets do not work because of probably an utter shortage of insulin secretion from the cells of pancreas. So, well, you will have to choose insulin as a remedy, maybe along with drugs or without totally on insulin. So, these are a few situations where you require insulin. So, insulin is, I tell my patients that it is something that is God given for you to metabolize glucose. So, definitely it cannot be bad. The insulins that have been designed or invented or right now we use are very similar to the God given insulin that is secreted in our body. So never resist taking insulin, start insulinization early. That helps in preserving your beta cells, that helps in preventing complications, that helps in not going on to excessive weight loss and muscle loss. So that's another myth. Another question that many of the patients ask: modern medicine can never cure diabetes, whereas other indigenous forms of medicine, some other streams claim that they can cure diabetes. So practically, if we look at the pathogenesis of diabetes, a cure is very difficult or very rare. There are some other forms of diabetes apart from type 1 and type 2 where the diabetes becomes well controlled even without use of drugs after a point of time. So that doesn't mean it's cured, you have to keep monitoring. And certain phases in type 1 diabetes, like 3 to 6 months, sometimes they have something called a honeymoon phase where insulin may not be required at all. So one should not think that diabetes has been cured and should keep the child or the young adult under monitoring. There are certain studies regarding diabetes reversal. There are studies with intermittent fasting. Those are very interesting. Like we know that any excess glucose that is there in the body that reaches the body is stored in the form of glycogen in the liver. So when one is starving, this glycogen is utilized as a source of energy in the body. So it's only after 12 to 14 hours of starving that glycogen starts to be, the reserve glycogen starts to be utilized in the body. So that is the principle of intermittent fasting. So if you go on to a prolonged fasting, this glycogen would be utilized. So there is no storage in the liver. And now liver is considered the seat of the initial organ which is crucial in the development of diabetes. So using this glycogen up and not letting it get stored is the whole principle of intermittent fasting. But as far as diabetes goes, one has to think about any measure, any lifestyle change that you can go on or that you can practice for a very long time. Diabetes is a long-term disease, it's a chronic disease, so one has to discipline oneself in practicing all the good dietary habits and exercise day after day, month after month. So any short-term change in your lifestyle, like intermittent fasting for 3 months, well, you may be, the diabetes may get very well under control, you may end up losing weight, but after 3 months, once you go on to a normal diet, you will tend to regain the whole weight that you have lost. So embark on or start on the modifications in your lifestyle, in your diet, what you can maintain for a long time. So whenever you make dietary changes or whenever you make any necessary changes in your lifestyle, you should be able to carry it on for days, months and years together. So still it's very positive that we have many drugs in the diabetes armamentarium which take care of all the players in the pathogenesis of diabetes, and we can get diabetes on target. Thank you.